So we were first asked to find an article that was current in our local area that discussed the opioid crisis within Kentucky that also related to our own nursing practice. So I chose an article that was in the Lexington Herald Leader in August of 2019 that was titled The Opioid Aftershock Kentucky Kids Born Drug Exposed Entering School Special Education Sees a Jump. So, this article discusses how teachers across Kentucky are reporting seeing first generation children who were born addicted to drugs. Or what is being termed neonatal abstinence syndrome. This article states teachers across Kentucky are seeing the first generation of children enter our schools in Kentucky in kindergarten, first grade, that were born with drugs in their system. So essentially, it's basically discussing how these children we're seeing an influx of these children who are now entering into the school system, and how that is going to continue to increase because between the years of 2001 and 2017, there were 8,500 babies born in the state of Kentucky that were born with NAS or neonatal abstinence syndrome throughout the state of Kentucky. We also, during this time between 2011 and 2018, which corresponds with those dates, have seen a surge of autism in the state of Kentucky. Those numbers have doubled between those years of 2011 and 2018. Certain developmental delays and disabilities are a consequence of the crisis, but we don't know which piece. That's stated by the Kentucky Department of Public Health Deputy Commissioner Connie White. What is known is that the syndrome can cause a range of behavioral issues and cognitive delays, and the schools, as a result, are already sensing a greater need for tailored education for these students. For certain, we will see an increase in children with learning disabilities and developmental delays and a need for individualized education plans, which is placing a demand on an already strained program and lack of special education statewide. It is going to create more of a need for special educators in a system where we already are in a need for additional special educators and additional funding in an already strained funding system where they're already making cuts of special education systems. The other issue is following these kids. There's not a real great way to follow these children. They're basically just born and then lost kind of to the system. So there's talk of trying to follow these kids and follow how many times they're hospitalized or brought back into the hospital and for what reasons they're brought back into the hospital. They also discuss how the treatment, the moms, the treatment that these moms receive and the drugs that these moms receive as part of their treatment are actually just as detrimental to these babies as heroin itself. However, basically they're giving these moms the treatment in a controlled setting, basically assures them that these moms will get prenatal treatment, so that's protecting both the mom and the baby. The Cabinet for Health and Family Health and Family Services, they're the ones that are talking about creating a database to begin tracking these children who are born with NAS. So when they're readmitted, we can find out why, and maybe that will help track their learning disabilities and those issues. Um, Basically, they talk about that these children are our responsibility um, throughout the state, and everyone needs to be aware and help keep them safe. So, moving on to the actual assignment of the teaching plan, um, just looking at kind of an article that I chose, looking at the differences between opioid treatment versus acupuncture, which is what I chose for my non-pharmacological treatment to replace opioid treatment. My article talked about the impact of the opioid addiction with pain management and the impact of acupuncture as a alternative to opioid treatment. It gave some kind of interesting facts regarding opioids and the opioid crisis in the U.S. That just were kind of alarming. 90 Americans die every day from an overdose of opioids. Opioid misuse costs the U.S. $78.5 billion every single year. There are 259 million opioid prescriptions written every year in the U.S. Over 80% of all opioid use throughout the world is used in the U.S. From 1999 to 2010, we increased the sale of opioids by 4 times. So just kind of looking at, we kind of created some of this problem on our own. But looking at kind of switching gears and looking at switching over to some non-pharmacological help for patients to try to get them away from some of the opioid use and trying some non-pharmacological options before we automatically jump to having to use pain medication. So I chose acupuncture. I posted a link to my actual handout because I know you can't see it very well there. But what I discussed was, did you know that acupuncture is used to relieve pain associated with many different diseases and conditions? Some of those include chemotherapy-induced and post-operative nausea and vomiting, headaches including migraines and tension headaches, low back pain, neck pain, osteoarthritis, menstrual cramps and labor pains, respiratory disorders such as allergic rhinitis. Some things that patients need to consider is not to use acupuncture to postpone seeking health care for a particular health problem. Be sure to ask about credentials of the provider before receiving treatment. Most states do require a license or a certification to practice acupuncture. Also, some conventional medical practitioners, including physicians, can practice acupuncture, so that may help with the insurance piece. If your insurance doesn't cover an acupuncturist, if your medical provider can do it, that might help. And then asking about the estimated number of treatments, because it typically does take more than 1 or 2 treatments. So asking about the number of treatments and how much each treatment will cost, and whether or not insurance will cover. And then also the safety and side effects of acupuncture. There's been known to have very few complications from acupuncture. Some complications that have arisen can be related to non-sterile needles or improper delivery of treatment. In very few cases, there's more serious complications that have occurred. In regards to my target audience that I used for my teaching plan, I used patients over 18 who were being treated in an outpatient setting for migraines by their primary care physician. These patients have tried treatment for migraines and failed, but are not on opioid treatments. These patients have tried other means of non-pharmacological treatment, such as hot and cold therapy, guided imagery, body-mind techniques, as well as massage. Some of the patients are reluctant to the idea of acupuncture, mainly due to the use of needles. My outcome is at the conclusion of the presentation, the patient would be open to considering treatment by acupuncture for their headaches. Specific learning objectives, cognitive, the patient will be able to verbalize at least 3 benefits of acupuncture for pain related to migraine headaches by the end of the presentation, and the patient would be able to explain the process to a family member or friend of what acupuncture is and how it works by the end of the presentation. Effective, the patient will agree to a discussion group to discuss the benefits of acupuncture for pain related to migraines, as well as to hear success stories from other patients. And the patient will accept and agree to read written material regarding the benefits of acupuncture by the end of the meeting. Psychomotor, the patient will reach out to a friend, a coworker, and or a family member who have received treatment by acupuncture for migraines to discuss their experience within the next week, and the patient will reach out to 3 clinics who offer acupuncture to inquire about their facility, and clinicians to answer questions and make an appointment within the next week. Evaluation techniques, the cognitive evaluation would be the learning will have occurred if the patient can identify 3 benefits of acupuncture for pain and has explained the acupuncture process to a friend or family member. Effective, the learning will have occurred if the patient attends and participates in a discussion group. And the psychomotor, the learning will have occurred if the patient reaches out to a friend, coworker, or family member to discuss their experience with acupuncture treatment and has made an appointment for themselves within a week. That is all. Thank you all.